How is your Monday moving so far? Probably, if you've got a child at home, it could be you actually, maybe you could be getting it from somewhere for the past 2 weeks. You could have realized there is that strange cough that that has invaded your home area. And now we're going to be speaking about it and learning more in regards to that influenza that is escalating, especially reportedly from schools around the country. We're going to hear a response from the Ministry of Health in regards to the escalation cases of influenza. Joining us now is Jessica NSUNGWA, who is the Commissioner of Child Health at the Ministry of Health, to dive through that particular situation, and Jerome Paul here with us. Thank you so much, Madam Jessica,
Good morning,
for joining
viewers.
us.
Good morning, viewers, and thank you for inviting me.
Very well. Now, if you could as well let us understand what influenza is, and also how do I know my child has got an influenza or is just, coughing?
Thank you very much. Influenza is one of the common viral infections which affect the lungs and the airway. So it's called one of the acute respiratory infections. It's a virus as opposed to a bacteria, and it belongs to a group of viruses. There are many other viruses which are even more common than influenza. Influenza comes in different types. It has been typed. Influenza A, influenza B, even within each influenza you have subtypes. So this influenza normally runs around all year round, especially type B. But once in a while we have seasonal spikes. It's actually called seasonal flu because of that. Especially in the developed world where they have seasons like winter, you get flu, this seasonal flu around that time. In the tropics, unfortunately, this flu runs more continuously, it's milder, and the epidemic or the spikes are not very predictable. So that means in the developed world it's more predictable, so they are able to prepare for it. So here it's very unpredictable because you can go a whole year round without a spike, and then sometimes you have a spike. So these spikes have been happening, and recently, unfortunately, we encountered this spike. This spike came around the time of COVID, and I think it got confused with that, but we are coming out of the phase 3 of COVID, and we are now have this influenza which has built on that situation where we are going down in the COVID cases. So that mix-up caused a problem. How did we know it was influenza? And how do you know that it's influenza? Because I said influenza is one of the common viruses. Actually, the commonest virus which causes infection in children is called RSV. It's called respiratory syncytial virus. It's not influenza. But in the smaller children and the older age group, the older elderly people, you have it coming on more common now. So how do you know that the child has influenza? It's very difficult to know that the child has influenza because a child will present with the typical symptoms. Like any other cough, you have a flu, you have body aches, you have irritability if they are small, they may run a fever, sometimes it can run for a long time. Unlike malaria fevers, which are kind of cyclical. So you have this fever which is lasting for a long time. Some kids have some wounds in the mouth, and even the smaller ones may even have diarrhea and vomiting. So basically for the younger children, the symptoms are not very specific. But as they grow older, about 5 years, then you get more of the chest, of the airway symptoms. Flu, cough, continuous cough. Most of the influenza and other viruses are very self-limiting. But when you have a very severe infection of influenza, then it will not go very easily. And moreover, the influenza itself will push your immunity down, that any bacterial disease which is waiting on the door will come in. So many of the problems we have in Africa is that we have the influenza, and then we have a secondary bacterial infection, which causes the problem mostly. So you have these community infections waiting to come on, and when the immunity goes down, because any virus like you've known now, they really depress our immunity, and they make these children very prone to other bacterial infections. And then you end up with some severe pneumonias.
Okay. At least we know now, we have understood how it comes about. As my colleague comes in, you're mentioning about as you grow older, 5 years, you realize it becomes more severe. Does that mean that when a child gets this virus, it remains in the body waiting for them to grow up and escalate?
No. Unlike other diseases where you have a disease which becomes inert, the virus doesn't live in your body, it just attacks you. And because it's a very infectious disease, because you can either get through droplets, but you can also get through aerosol, that means small gases, small pellets, or you can actually get through contact. So if you are in a vicinity near somebody who has this virus, through those three means you can actually pick it very easily. And that's why you see it tends to cluster. You get it in clusters because it infects people who are together, who are crowded, who are sharing the same environments or same classrooms, for example, the children.
Okay.
Let's also look at what should the parents be worried most about this influenza outbreak.
Yeah, this influenza is usually mild.
Okay.
And as I said, it's seasonal. It will come and go away. Ideally, it's self-limiting. It comes, you have that seasonal flu, people think it's dust or what, and then it goes. Unfortunately, sometimes you get a severe form. We have two types of viruses, common ones, Haemophilus influenza A and Haemophilus influenza B. Influenza A is the one which tends to bring on the more severe cases. And in Africa, mostly we've been seeing the type B, and actually we have a vaccine for type B in Uganda. But once in a while you get the A escalate, and then you have a more severe disease. And you start seeing how do you get to know that there are problems? We start seeing more cases in the hospitals. We start seeing more severe acute respiratory infections in the hospitals. We also have sentinel sites where we are monitoring just to be on the lookout. We also start seeing cases escalating. And then now we know that there is something which has happened, and then we go in to confirm. We take off specimens from children who have been admitted with severe disease, and sometimes randomly, even for those with mild illness. And then we're able to confirm that actually this is not the usual flus. Now we have Haemophilus influenza coming on, especially type A.
Okay.
So is there any damage that can actually be caused on the children?
Oh yeah, like any other disease which affects the lungs or the airway. Like as I said, as the virus itself, first of all, it pushes your immunity down. So the child is likely to get any problem, especially the smaller ones. Because the whole immunity is going down, they'll get diarrhea, they'll get infected with other problems. But they will also get pneumonia. And once they get pneumonia, pneumonia is when your lung consolidates with fluids and becomes more solid. And that damage can also affect the child. Lucky enough, most children, because their bodies are growing, most of these organs are able to repair themselves.
Okay.
Yeah.
And probably if you could share with us from the perspective of Ministry of Health, you said earlier you determined by getting samples. I don't know whether Ministry of Health has already collected samples from schools. You could share with us what is escalating, what is that we have, A or B, and in comparison with the COVID-19, what is the level of danger?
Yeah, so we have two systems of monitoring. As I said, we have around 11 sites in the hospitals where we monitor continuously. We're just looking out, it's called sentinel surveillance. But also we have some community sites where we are monitoring to be on the lookout. Usually we've not been doing school surveillance, but now we have a system after COVID where we are monitoring all these symptoms, common symptoms, flu, cough, headache, and once we see an upsurge, we get a warning, then we go in. So what happened this time was that when we had this escalation, we took specimens quickly around Kampala, and we're able to pick both Haemophilus influenza and Haemophilus A and B in the case. So we knew we were having a problem. And so we have escalated our surveillance work countrywide to make sure that we are monitoring. What has actually basically happened in most hospitals is that there have been an increment of about 20 to 30% severe cases of acute respiratory infection. And that is what we monitor mostly. As far as when you get the smaller babies, the rate may be even higher. And we started hearing people running out of oxygen, small babies being on oxygen and being admitted and space getting finished. That is what exactly happened. Concerning the schools, we had slightly milder disease, and we haven't actually registered many deaths. Some few deaths occurred in the smaller children, and those were actually expected. But this actually disrupted the whole school
when
system.
When you speak about some deaths, could you give us statistics?
Yeah, we don't have a national figure because then you have to confirm. But we have seen deaths go up to, especially the infants, up to 5% increment from our routine system. But many children will die from the communities or in the private clinics. So there was an escalation from the people who have been able to collect some data, some 5% increment in mortality, but we are continuing to collect this data. So in the school, the basic problem is that this problem did disrupt the schools. And the schools' first reaction was, are we going to close the schools? And that caused a lot of panic in the parents. It's also a problem because if you send children back to school, then you're causing another bigger problem. You disrupt the parents, and it even causes more problems. You saw what happened during the COVID. People who are more marginalized actually suffered more. So there was a concern about closing the schools, but evidence shows that the best thing to do is not to close the schools. Even if you have to close the schools, you have to do it more proactively. You can close classrooms, you can reschedule classes, but there's a lot of evidence to show that this is better managed in the schools, and we handle them. We monitor the sick cases, and then when they get severe, we actually admit them to the hospitals, and that's what we've been doing. Also, the media sometimes also causes some problem because I think the media really blew it out of proportion, and parents started panicking. The Ministry of Education and Health started working around the clock to solve. But I must say right now the cases are going down. We're seeing a downfall, and we think this is going to continue, but we have to continue being prepared. Lucky enough, we have vaccination for type B. We vaccinate children at 6 weeks, at 14 weeks, and at 10 weeks and 14 weeks. Haemophilus influenza A is more difficult because most
to control.
Yeah, most episodes every year, they come up with different subtypes. So you need about 6 months to confirm which subtype has come on this year and develop the vaccine. So you find that most countries, especially like us who don't have this pandemic very frequently, we may not be able to have those vaccines. So the best method is to use what we call non-pharmaceutical measures. So we try to prevent, if we know that the epidemic has come, we try to delay it from spreading where it has not reached by making sure that we separate people who are likely to be infected from the other. So we do what they call social distancing now, what that one is. But also we make sure that people who are infected, we try to protect them as much as possible. They should wear masks. But also to be on the safer side, since you don't know who's going to be coming, you're going to come across, it's also better for everybody to wear masks. Masks are quite effective, but also hand washing. Hand washing is another method you can use. And also to avoid touching many objects or surfaces. And we encourage in schools for them to disinfect these surfaces as much as possible. So those non-pharmaceutical measures are very, very effective, especially in the countries like ours where we have mostly a warm climate. But once in a while, you get some escapes, as I said, especially the very small babies, the infants, the newborns, then it becomes very severe.
Okay, then.
When you look at influenza, let's look at influenza B and then the other type. How do you differentiate between the two? And how can you easily tell that if it is a parent, how can the parent tell that my child is suffering from this type of influenza? There are some telltale signs. First of all, the clustering. Okay. You start seeing the clustering of disease. You go to this community, people say, oh, people are coughing so much. This cough is not going. Is it the weather? So it's an upsurge. It's an epidemic. It spreads very quickly. It catches very many people, unlike the usual flu, which is sometimes limited to one household. So you start knowing that there's a problem, and that's why our surveillance helps us a lot. A mother herself will not be able to differentiate, but these kids tend to have very continuous cough. They are coughing a lot. I think many parents have been reported, oh, my kid is going to cough off her lungs. They cough a lot, they get blockage in the airway, they are fighting with the breathing, they are not comfortable at night. So basically, a child has a more severe flu. If COVID was called Senyiga Omukambwe, then this one is called Senyiga Omukambwe. It's in the middle. It's severe, but not as severe as COVID. Okay. But also, it's not as mild as the usual flus we have. It also takes me to that, to my other question when you talk about COVID. Why is there seemingly not too much attention or concern of the influenza outbreak as it was with COVID, because with COVID, we even had to get into a lockdown where schools had to close down.
Yeah.
Now we have influenza, which also seems deadly.
Yeah.
Like you've mentioned of some figures of
Yeah.
some death recorded.
Yeah.
Why is it that we have less concern about this?
Yeah. First of all, even before I go to the influenza, we've learned a lot of experience from COVID.
Okay.
And we have set up systems. We've been working with schools, we have been working with the Ministry of Health. We've established systems, and it's a good coincidence that has come at this time. So our reaction will not be as same as we did in COVID-1, for example, because we have systems established. We have a school surveillance system in place. We have a linkage of the schools with the health unit. We have a daily reporting system. So we know we can mitigate this situation and handle it. So we didn't want to have to close. But also, as I've told you, there's not enough evidence to show that if you close the schools and you disrupt the system, that you'll be able to control this pandemic. However, as I said, you can do more proactive closure, that you can close classrooms, you can limit it geographically, and avoid this very invasive, disruptive, economically disturbing situation of closing, because as long as you take these children back to school, you're actually seeding the epidemic more to the communities, because you may go to places where there was no problem. But also some of these homes where these children go back, like we learned from COVID, they find very elderly people there, parents die. So we also want to make sure that we are protecting the elderly people and those who have comorbidities, because those will suffer more than the normal people. So young children, especially infants, elderly people, and those with comorbidities are the ones we are most worried about. So even in the schools now, we are registering all the children with comorbidities, and these ones we want to make sure that we closely monitor them, and once they get systems, we move in very quickly.
And you talked about the virus being the cause of this influenza. What more does cause this influenza?
Well, like I said, people who have low immunity for any reason, age is one of them. As I said, the younger, the older you are, the lesser immune you are. But also if you have comorbidities like conditions like HIV, non-communicable disease, hypertension, diabetes, if you've suffered from TB and you have some chronic lung disease, people who smoke, all those people have a higher risk. When they get these flus, then they have a higher risk. But we also have people, because of the nature of their work, they are at higher risk. Health workers, people who provide services to people, also those at higher risk. So we also have some workplace policies when an epidemic like this happens. So basically we focus on schools, especially if this is happening when they're in school, children are in school, and also workplaces, but also work through the healthcare system where patients come. We also want to make sure that we are not infecting our patients who are coming. So we also create some systems, we triage these patients, so that if you have any symptom, we try to make sure that we manage you in a separate area. And pregnant mothers, by the way, also are one of the high-risk group.
Of getting that?
Yeah, they also tend not to do very well when they get this influenza. They get more severe symptoms than the general population.
Okay, and now what are you doing, or what have you done so far to control and manage the influenza situation?
Yeah, the first thing we've done is to increase awareness, because we know the problems which can happen when people don't know, or when people just go into a panic. People to know that there are ways of preventing the spread. There's nothing much you can do once the virus has come, but there are ways of preventing the virus from spreading, of containing it in one place, but there are also some remedies you can use. As I said, because it's a virus, it has no treatment. It has no antiviral drug you can give and say, I'm going to treat and stop this virus. The best thing is to make sure that when it comes in your body, you have a very smooth ride, you don't have a very severe illness developing. We try to teach them how to give soothing remedies, because it irritates the cough. We are giving these children what we call antipyretics to keep the fever down, and these children need to drink a lot because they get dry, but also we need to make sure that we monitor their breathing. For the young babies, we look at how they breathe. Are they breathing faster? Are they breathing with more difficulty? Then we start worrying whether the illness is progressing, or as I said, they're having a super infection on top of the viral infection.
All right, now let's also look at this year. We have 2 months to the end of the financial year. Has this in any way inconvenienced the budget of the Ministry of Health?
Oh, definitely. Indirectly, though, because as I said, this came when we were finishing COVID. Indirectly, there are direct costs, of course. Remember now we are treating more cases than what we had planned. So the health system is getting stretched, especially for the vulnerable populations. But also the schools are also having to manage these cases. And they're also spending more. The parents are spending out of pocket. Some of them are still having to, their day scholars are having to take their children for treatment. Many pediatricians, their clinics have been very full. The LPDs have become very full. So, yeah, generally the budget is affected indirectly. We are yet to go to Parliament to ask for a specific budget because we're still watching and monitoring, and we think that the cases are going down, so, but we'll continue to monitor. So if there's an upsurge and we need to do something more than this, then that one will come into play.
Okay, and when it comes to monitoring, like you say, is there a point where Ministry of Health, you're getting into a worry that you may not tell at some point whether the situation is COVID-19 or influenza that is arising?
Yeah. So what we do, unlike you've heard that some countries are relaxing, Uganda has taken a more cautious approach. We think that the pandemic has gone down and has kind of leveled off, but we are still on the watch out. We're still getting cases once in a while. You're all aware that some countries are also registering increment. In New York last week, I think that a 40% increase from the last 2 weeks, and Hong Kong and other places, so we're in the watch out. So we continue to test for COVID in this country. We continue to test for COVID, especially for who have symptoms. The testing centers are still open, but also for travelers, people who are coming in, we test. So we're still testing. So we're not saying now it's influenza and we have forgotten COVID. So we're doing both. After all, you can even have both anyway. Yeah.
It is possible that my colleague can take you through that.
Yes.
Now also still with the issue of schools, and let's look at it in the angle of the Minister of Education.
Yes.
Is there any way that the Minister has been reporting to you some cases that have been severe, or that have actually gone overboard than what you were expecting?
Yeah. Let me tell you how it works.
Okay.
We have worked with the Minister of Education through this whole last 2 years, and we have mapped the schools. Every school is attached to a health facility. Okay. So every day the schools register every child who is sick.
This happens to both public and private?
Private, yeah. And every case, every day they're supposed to send data to the nearby health facility using SMS. And this data is transmitted to the district and the national level. And that's the data we look at and we start saying, okay, there's a problem here. Okay. So this school surveillance system is helping us already. It is run and supervised by the Ministry of Education. We are the recipients of the data. Okay. And that means we have a dialogue. The Ministry of Health has a strategic meeting for COVID previously, but we're going to use the same, I think, system. And also the Ministry, we have a committee where we're able to interface with the Ministry of Education. We're actually working very, very closely. And when there's an issue there, we create these dialogues. At the national level, we have these committees. At the district level, we have the district education officer, the district health officer. They have a task force, and the local government, which is a product of COVID, but they are continuing to use this for surveillance. So this surveillance, even if COVID goes, will continue to be used for other conditions. We are now working on our plan, transition plan to our new normal. There's going to be a new normal, because whether we like it or not, we are going to live with the impact of COVID for some time. So we're going to work on a new plan, and our hope is that we are going to continue doing surveillance and probably broaden it to other respiratory infections. And influenza would be one of them.
Okay, thank you. And if you just joined in, we're still speaking about the escalating influenza that is happening in schools, and probably even in your home. You could be one of them, or one of your child could be the one coughing around there and having those symptoms we talked about. Jessica NSUNGWA is from Ministry of Health, presenting as a Commissioner of Child Health. You talked about the 5% death that has increased, and this has as well increased my curiosity, even maybe the viewers' curiosity and fear at some point. Is it a disease to worry about?
Oh yeah, it's a disease to worry about. Not only does it have health consequences, I'll talk about the school children, it disrupts the study. Teachers are also getting this problem. So it's disruptive not only health-wise, but also economic-wise and socially. So we need to worry about it. Remember, we have lost 2 years where our children have been out of school. So this is extending it a bit further is not a very welcome idea. And we have learnt a lot. And I think the country needs to start continuing to think about how we make sure that we have regulations which are on the lookout for these health security issues. So we are trying also to invest more money in health security issues which have to do with the borders but also internally. So we have to worry about this problem because definitely it's going to impact on the families as individual families but also as government. So we will be doing some costing studies like we've done for COVID, and one of these days we'll be able to share some data on the impact of this influenza episode. The issue is, I think we need to look out for is that we need to be prepared for the next subsequent health security issues, maybe influenza again. So, and that is the system we want to work on in this whole transition, that we are always ready. We have a standalone mechanism and resources to respond immediately. So these pandemics or epidemics, when they come, we can actually contain them in a very small area so they don't spread out so much. And even if they spread, that we have mechanisms to deal especially with the disruption of schools, of the healthcare services, of the economic activities, and also be more innovative to work around these pandemics, which are probably going to continue for some time.
And when you speak about mechanism, is it something that is already there even when we get mild infections and cases around? The Ministry of Health can handle in our hospitals?
Yeah. In addition to what we have invested from COVID, we also have our roadmap, even before COVID, of how to strengthen these systems. So COVID just came up, it was a wake-up call for us, but we have mechanism of strengthening not only surveillance, but response, but also increasing demand, care-seeking demand. Many patients delay to come, and our biggest problem, the patients who come to us usually come very late. We want the parents to be aware of the danger signs. They need to know when to come in. We want them to go to the right place. Sometimes they spend a lot of time, and by the time they come to us, they are too late. It's too late, even our system cannot save them. So we need to do a lot more on terms of health promotion, educating the people, giving children life skills so that they also know, because I think it's a very important thing to invest in this future human capital, but also to make sure that we increase our human resource, our health workforce. And as you can see, like the Ministry of Health now, we are restructuring. We are increasing the human resource and the structures, again, to have more health workers, but also the salaries have been worked on, you know, which is also very important because it motivates. But also, we are also working with other sectors to have community health workers, a community resource system, community health extension workers, and we are hoping that this parish development model will also enhance and include us. So we are looking, we have a very positive approach, but we want to remind people.
Parish development model to include people from Ministry of Health?
The village health team members.
Okay.
Yeah, as a resource team.
Okay,
I also forgot to ask, you did mention that you've been working with schools and they've been sending in details to the health teams around the regions. How effective has that been? How have the schools been able to do this? Or do we have some schools that have also failed as well?
Well, it didn't take off as fast as we thought because we had enough time to establish, but when we opened the schools, the number of schools we were registering with the system have been very gradual. And you know what happens to human beings? When the COVID went down, that also again affected the speed of pickup. But as I said, our transition plan for COVID is mostly going to be centering on strengthening surveillance. So we are going to continue pushing for this system. We're going to continue working with our sister ministries to make sure that we have a system now moving forward, which will not only do surveillance for COVID, but also will tell us when there's a malaria epidemic. You get the point? Malaria still kills very many children. So, and it will also help the schools to strengthen their school health services. We want schools to have school nurses so that these problems can be contained very quickly. Instead of having to refer these children or send them back home, we are also strengthening our school health policy. The Ministry of Education has finalized this policy, and we are hoping that we should be able now to have it funded and implemented nationwide. We've also learned a lot of issues through this system, and we want to strengthen the inspectorate system, school inspection system. And Ministry of Education is working a lot. Some schools for a long time have gone into a bit of decay. There's a lot of overcrowding in many schools. So the Ministry of Health Education, this is one of the things they're actually tackling now. They want to make sure that they use this to have a kind of a reform in the education sector.
Okay, now let's head a little bit about COVID. There is an upsurge of COVID infections in China. Reports having it that right now Shanghai is on lockdown.
Yeah, partial lockdown
because they're actually trying to mitigate the effects there that will actually impact onto their trade. But if you bring it here into the Ugandan context, we do remember in 2019 when Wuhan recorded the very first case. We did not have it as a concern.
Yeah.
Not until we actually felt the pinch in March.
Yeah.
Now my question is what is the Ministry of Health doing to ensure that we do not get into a similar circumstance as of March 2020?
Yeah, first of all, the world has opened up.
Okay.
Travel is back to normal or near normal, and anybody from China can come to Uganda anytime. And that's why you see Uganda, in fact, unlike our neighbors, we're still insisting that testing at the border points, especially the airport, continues.
Okay.
There's been a bit of criticism, but we want to be slightly cautious. And as I said, we use data and following up. And soon we'll be thinking about how to relax, but we don't want to move with everybody because our problem is slightly different from other countries. So we want to do a Ugandanized decision process because these people are going to come in and our people are going to go there and come back. So we are on the lookout. I think recently the CDC is also discussing this in more detail. As I said, some places in the US also have started seeing upsurge. But we are also working on vaccination because right now our biggest bullet we have in the country to make sure that we save our people is the vaccination. We are continuing to drum the idea of vaccination. We have pushed, now we are promoting a third dose, booster dose for the vulnerable people. In the US, they're discussing a fourth booster dose because this immunity after about 6 months or so winds down. And as I told you also, the strains are not sleeping. They keep changing and they're keeping us thinking very hard. So I think the message out there is that people should get vaccinated. Although the pandemic has gone down in the country, we need to vaccinate people. We need to make sure that those who are more at risk get their booster doses. And we have enough vaccines in the country. We have enough vaccines and people should not fear. They should be able to get. We have also introduced new policy. People have been complaining that this type of vaccine is not there. There's a new policy now on mixing these vaccines. There's enough evidence to that actually we can mix these vaccines. So people should not have an excuse of not having their vaccines. They should not slacken. Because if some problem comes up, they will be the first people to suffer. We've been recording cases of deaths in COVID, and I can assure you most of the deaths we are seeing now have not been vaccinated.
All right.
Most of them.
You being a commissioner of child health at the Ministry of Health, if you could share with us the vaccination limitation when it comes to influenza. Let me take you back to influenza.
Yeah.
If I miss the vaccination at 6 weeks, at 6 months, is it too late when I get, after acquiring the disease?
Yeah.
Can I even get vaccinated in the middle of the situation? Talk to us about vaccination processes.
So our Haemophilus influenza vaccine is one of the routine vaccines. It's a scheduled vaccine with or without a pandemic to continue. And as I said, it targets the B type. We give it in a pentavalent. It's mixed with, we combine it with other vaccines. Previously, we were giving polio, each one separate, pertussis, TT. But now we have a vaccine which combines 4 or 5 vaccines. And we give those vaccines at 6 weeks, 10 weeks, and 14 weeks. And this has to continue. We are not vaccinating for the pandemic yet, as I said, I told you.
Yes, please.
The problem we have is that Haemophilus influenza virus, which causes the pandemic, the fact that it shifts very quickly, and we need these vaccines to be developed very often. And as a low-income country with lesser pandemics, we may not be able to get those vaccines in time. If we wait for them, we'll lose people. So it's better that we consolidate our Haemophilus influenza. Let's have every child immunized. We have some children definitely who miss or drop off, but we also have some catch-up plans. So when we get you, then we work on a catch-up plan. Make sure that we can make you catch up from what you've missed. And so that's why we work so hard, and sometimes we have to do some campaigns, sometimes, to make sure that we pull out everybody. So we do some of those programs for people who drop off, not only for Haemophilus, but also for other vaccines.
Okay, thank you. And we're wrapping up this discussion. My conclusive question as Mike Durham comes in is what is your message to schools? Is it time now to move on from COVID-19 and we focus on influenza? What can you tell us?
My message in schools is that we need to implement school health, the school health program. COVID is just one of them. Okay. We have problems for young people. Recently, I met a young man who went to India. He got TB in the school and it ate his whole airway and one lung collapsed. So he's just been in India to have an artificial airway modeled for him. So we still have other problems. So we want the schools to strengthen the school health program. It has very many elements, including physical activities, but also life skills, sexuality education, malaria control, nutrition. We want a comprehensive system. So schools need to invest in this school health program. Many schools don't have school nurses. And we are going to become more vigilant on this. Schools should have school nurses, trained school nurses who can have refresher training on a routine basis. Schools should also share information with the Ministry of Health. We want to strengthen the routine school health information system so that we are always aware and we can come in a timely manner and support the schools. We are supporting the public. The bigger population in Uganda are children, are young people, and most of them spend their time in schools. So if we are going to impact in this country in any way, on any health indices, we need to work on schools. We need to work with the schools. Yeah.
Jerome, what is your remark as we conclude your take home?
Mine would be on the issue of the vaccination drive in schools. How far have you gone with that? And are you also looking at the young children in primary?
Yeah. Some countries have considered the younger children.
Okay. Because
of vaccine availability and our projections, we could not vaccinate younger children. But also younger children require specific vaccines. Some vaccines have not been tested or established to be safe for children, for younger children. So we needed to have those vaccines. So when we worked out our projections, our population, our most vulnerable people, and the money we would need to buy vaccines for the small children, we realized that we needed to prioritize this other age group. And we can always revisit this.
Back down to a parent.
Yeah. I think we have learned a lot of things. I'll start from what we have learned. We have learned that the school health issues, we need to work together with the Ministry of Education. But most importantly, we need to work with the community. In places where we handled COVID very well in the schools, it's because the schools worked with the community. The parents have to be involved on the table. The parents must know about the decisions. Parents panicked and they got so upset because they didn't know when the schools were going to open. The information wasn't free. So we have learned that the best thing to do is to invest in a partnership where we can sit together and plan together, and when we have such episodes of problems, we need to work together and be able to work on them. The other thing I think we have learned, of course, is a general issue on schools. I think schools, we have received a lot of insights. And I will not talk for Ministry of Education, but I know they have a big plan. But as I said also lastly, that the issue of health security. Today is COVID, tomorrow is another thing. This is a regulation we have signed and appended our signatures to, and we need to make sure that we functionalize that. Our borders are very awake and alert for all these problems, that we have systems in place. But if we have some problems, we contain them very quickly. But also the data system we use in the country is very real. It's actually real-time data because it has some of these responses need to happen quickly. But also resources. We need to have a stand-alone budget which waits for only these problems. We're very lucky that people came in very generously, and we really want to thank the public for their generosity. That money really moved us to another level. But I think government needs now to continue to think about the possibility of those problems. But we want to thank government so much, because I think as a sector, they really prioritized us. The government has been responsive, the Ministry of Finance, and I think the Parliament also was so responsive. And I think this win-win game has been due to a partnership and involvement of everybody, including the media. I want to thank the media for your role you played.
You're welcome. And in less than
forward.
a minute, message to the parents.
Yeah. So parents, my message last minute is to tell you that health begins at home.
Okay.
I think what this COVID has exposed is that the parents have abdicated their role to the schools. When these young girls started getting pregnant, it became very clear that there was a gap in the home. So we want families as a core unit to reflect again, to go back, and we'll be working with them as government to make sure that families make sure that health is made at home, and health is not only disease, but also the other conditions like having an early pregnancy, early marriages. All those things have something to do with health. So health is made at home, and we need to see parents more responsible, take on more responsibility. We need to see government support the parents and the households as a unit.
Thank you so much for giving us your time. A blessed day from us.
Thank you very much.
And that has been Jessica NSUNGWA, the Commissioner, Child Health at the Ministry of Health, reacting on the escalating cases on influenza around schools, probably which is also in your home locality. I'm Rita Kabanyaro with Jerome Posonko, but after the break, Jerome returns with Business and Sport.